Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
As of my last update in January 2022, there have been reports and studies suggesting that COVID-19 can lead to various cardiovascular complications, both during the acute phase of the illness and in the post-recovery period. Some of the heart-related issues that have been observed in individuals after recovering from COVID-19 include 1. Myocarditis. Myocarditis, inflammation of the heart muscle, has emerged as a concerning complication in individuals recovering from COVID-19. The SARS-CoV-2 virus responsible for COVID-19 can directly infect heart muscle cells, triggering an immune response that leads to inflammation. This inflammation can weaken the heart muscle, impairing its ability to pump blood effectively and potentially resulting in long-term complications. During the acute phase of COVID-19 infection, individuals may experience symptoms such as chest pain, shortness of breath, and palpitations, which can be indicative of myocarditis. In some cases, myocarditis may occur without obvious symptoms, making it challenging to diagnose. However, diagnostic tests such as electrocardiography, ECG, echocardiography, and cardiac MRI can help identify myocardial inflammation and assess its severity. The long-term consequences of myocarditis can vary depending on the extent of heart muscle damage and the individual's overall health. While some individuals may recover fully with appropriate treatment and rest, others may experience persistent symptoms and complications, including heart failure, arrhythmias, and sudden cardiac death. Management of myocarditis typically involves supportive care, including rest, medications to reduce inflammation and manage symptoms, and close monitoring of heart function. In severe cases, more advanced interventions such as implantable devices or heart transplantation may be necessary. Given the potential for myocarditis to cause significant morbidity and mortality, healthcare providers must remain vigilant in assessing and managing cardiac complications in individuals recovering from COVID-19. Timely recognition and intervention can help minimize the long-term impact of myocarditis and improve outcomes for affected individuals. 2. Arrhythmias. Arrhythmias, or irregular heart rhythms, have been observed as a potential consequence of COVID-19 infection, both during the acute phase of the illness and in the post-recovery period. The SARS-CoV-2 virus can disrupt the electrical signals that regulate the heartbeat, leading to abnormalities in heart rhythm. In individuals recovering from COVID-19, arrhythmias may manifest as palpitations, dizziness, fainting, or chest discomfort. These symptoms can range from mild to severe and may occur intermittently or persistently. Common types of arrhythmias associated with COVID-19 include atrial fibrillation, ventricular tachycardia, and bradyarrhythmias. Diagnosing arrhythmias in individuals recovering from COVID-19 requires a comprehensive evaluation, including a detailed medical history, physical examination, and diagnostic tests such as electrocardiography, ECG, Holter monitoring, or event monitoring. These tests help identify the type and severity of arrhythmias and guide treatment decisions. The management of arrhythmias in individuals recovering from COVID-19 depends on the type and severity of the arrhythmia, as well as the individual's overall health status. Treatment options may include medications to control heart rate or rhythm, lifestyle modifications, and procedures such as catheter ablation or implantation of pacemakers or defibrillators. It's important for healthcare providers to monitor individuals recovering from COVID-19 for signs of arrhythmias and to provide appropriate management and follow-up care. Close communication between healthcare providers and patients is essential to ensure timely intervention and optimize outcomes. 3. Heart failure. Heart failure, a condition where the heart is unable to pump blood effectively to meet the body's needs, has been identified as a potential complication following COVID-19 infection. The underlying mechanisms contributing to heart failure in individuals recovering from COVID-19 may include myocardial injury, inflammation, and oxidative stress. Additionally, pre-existing cardiovascular conditions such as hypertension, coronary artery disease, or myocardial infarction can predispose individuals to heart failure after COVID-19 infection. Symptoms of heart failure in individuals recovering from COVID-19 may include shortness of breath, fatigue, swelling of the legs or abdomen, and reduced exercise tolerance. Diagnostic tests such as echocardiography, cardiac MRI, and blood tests can help assess heart function and determine the severity of heart failure. Management of heart failure in individuals recovering from COVID-19 focuses on optimizing heart function, relieving symptoms, and improving quality of life. Treatment strategies may include medications such as diuretics, AC inhibitors, beta blockers and aldosterone antagonists, lifestyle modifications, and in severe cases, interventions such as implantable devices or heart transplantation. Close monitoring and follow-up care are essential for individuals recovering from COVID-19 who develop heart failure, as timely intervention can help prevent disease progression and improve outcomes. Healthcare providers should work collaboratively with patients to develop personalized treatment plans tailored to their specific needs and circumstances. Furthermore, ongoing research is needed to better understand the relationship between COVID-19 and heart failure, including the long-term effects of myocardial injury and inflammation on cardiac function. By elucidating the underlying mechanisms and risk factors associated with heart failure following COVID-19 infection, healthcare providers can develop targeted interventions to prevent and manage this complication effectively. Heart failure represents a significant cardiovascular complication that can occur in individuals recovering from COVID-19. Characterized by the heart's inability to pump blood effectively, heart failure can lead to debilitating symptoms and complications if left untreated. By recognizing the signs of heart failure early and providing appropriate management, healthcare providers can improve outcomes and quality of life for individuals recovering from COVID-19. Continued research and collaboration are essential to advance our understanding of COVID-19-related heart failure and develop effective strategies for prevention and treatment. 4. Blood clots. The risk of blood clots, including deep vein thrombosis, DVT, and pulmonary embolism, PE, is heightened in individuals recovering from COVID-19 due to various factors, including inflammation, endothelial dysfunction, and hypercoagulability. COVID-19-related blood clots can obstruct blood vessels, impair blood flow, and lead to serious complications such as heart attack, stroke, or organ damage. Symptoms of blood clots in individuals recovering from COVID-19 may include swelling, pain, warmth, or redness in the affected limb, in the case of DVT, or chest pain, shortness of breath, rapid heartbeat, or coughing up blood in the case of PE. Prompt recognition and treatment of blood clots are essential to prevent life-threatening complications. Diagnostic tests such as ultrasound, CT scan, or blood tests can help confirm the presence of blood clots and assess their severity and location. Treatment of blood clots in individuals recovering from COVID-19 typically involves anticoagulant medications to prevent further clot formation and reduce the risk of complications. 5. Pericarditis. Pericarditis, inflammation of the pericardium, the thin sac surrounding the heart, has been identified as a potential complication in individuals recovering from COVID-19. The underlying mechanisms leading to pericarditis following COVID-19 infection may involve viral-induced inflammation, autoimmune responses, or other immune-mediated processes. Pericarditis can cause chest pain, which may worsen with deep breathing or lying down, and may be accompanied by other symptoms such as fever, fatigue, or shortness of breath. Diagnosing pericarditis in individuals recovering from COVID-19 requires a thorough evaluation, including a detailed medical history, physical examination, and diagnostic tests such as electrocardiography, ECG, echocardiography, or cardiac MRI. These tests help assess inflammation of the pericardium and rule out other potential causes of chest pain. Management of pericarditis in individuals recovering from COVID-19 focuses on reducing inflammation, relieving symptoms, and preventing complications. Treatment may include medications such as non-steroidal anti-inflammatory drugs, NSAIDs, colchicine or corticosteroids, along with rest and supportive care. In severe cases or when complications arise, more aggressive interventions such as pericardiocentesis or pericardial drainage may be necessary. Close monitoring and follow-up care are essential for individuals recovering from COVID-19 who develop pericarditis, as timely intervention can help alleviate symptoms and prevent recurrence. Healthcare providers should work closely with patients to develop individualized treatment plans and address any concerns or questions they may have. In the aftermath of COVID-19 infection, individuals may face a myriad of cardiovascular complications that can significantly impact their health and well-being. From myocarditis and arrhythmias to heart failure, blood clots, and pericarditis, the spectrum of heart-related issues following COVID-19 infection underscores the importance of vigilance and proactive management in the post-recovery period. Healthcare providers must remain vigilant in monitoring individuals recovering from COVID-19 for signs of cardiovascular complications and provide timely intervention when needed. Close collaboration between cardiologists, infectious disease specialists, and other healthcare professionals is essential to ensure comprehensive care and optimize outcomes for affected individuals. Moreover, ongoing research is crucial to deepen our understanding of the underlying mechanisms and risk factors associated with cardiovascular complications following COVID-19 infection. By elucidating the pathophysiology of these complications, healthcare providers can develop targeted interventions to prevent, detect, and manage cardiovascular issues in individuals recovering from COVID-19. In conclusion, while the road to recovery from COVID-19 may pose challenges, with vigilant monitoring, timely intervention, and ongoing research, we can mitigate the impact of cardiovascular complications and support individuals in their journey towards optimal health and well-being.